you notice them. She notices you noticing them. And yet, when things finally heat up, most men spend barely a minute or two giving breasts any real attention. That is a missed opportunity. A woman's breasts are richly innervated, emotionally meaningful for many, and when approached with consent, patience, and good technique, can be a major source of arousal, and for some, orgasm. Today I want to give you a clear, respectful, evidence-aware playbook you can actually use. I'm Dr. Joanna Blake, urology and men's health expert. Quick reminder before we start. Everything here should be guided by consent and comfort. Ask, listen, go slow, and let her lead with feedback. First, set the stage with consent and curiosity. A single relaxed question changes everything. How do you like breast touch? Soft, firm, or mouth? Not at all. Any no-go zones? That conversation lowers anxiety, raises trust. Use a simple check-in code as you go. Green, more; yellow, gentler; slower; red, stop, shift. Second, slow way down and start wide. Most bodies do not jump from neutral to peak arousal in seconds. Begin outside in warm hands, broad palms, slow strokes over the upper chest, sides of the ribs, and the underside where tissue meets the torso. Layer and kisses at the neck, jawline, and collarbone if she enjoys that. Steady rhythm plus anticipation lets the nervous system switch from guard to receive, which is when touch starts to feel electric instead of ticklish or overwhelming. A tiny dab of body-safe unscented lube can make skin glide more comfortable. Third, hold with intention, not just fingertips. Use your whole hand to support the weight of each breast. Think cradle, not pinch. Alternate gentle compressions with stillness. Many women interpret confident, caring holds as "I want you" in a way that heightens arousal. Watch for breath changes, soft sounds, or the way her body leans into you. Those are green light signals. Fourth, give the areola real attention. The nipple areola complex has dense nerve supply. For many, the darker circle around the nipple is as responsive or more than the nipple itself. Try slow circles around the areola with 1 or 2 fingertips, or a soft spiral that approaches the nipple and then backs away. Combine that with a supportive palm underneath so the tissue is never pulled uncomfortably. Fifth, approach the nipples like a dimmer, not a switch. Start with feather light strokes. Then, only if she wants more, try a gentle roll between thumb and forefinger or a brief press and release. Keep movement smooth and avoid abrupt tugs. If she enjoys firmer stimulation, build gradually and keep checking in. Any sharpness, numbness, or zinging means ease off. A tiny bit of lube can prevent friction on delicate skin. Sixth, use your mouth thoughtfully. If she's into oral stimulation, begin with warm breath, then soft, slow licks around the areola before touching the nipple. Gentle suction can feel great. Clamp-like suction or teeth rarely does unless explicitly requested. If she asks for playful grazing, practice pressure on your forearm first so you know exactly how light to keep it, and stop the moment anything feels uncomfortable to her. Seventh, let words and breath amplify sensation. Quiet, genuine compliments about how she looks, smells, or sounds can deepen arousal. Keep your voice low and unhurried. Ask short, easy questions she can answer without leaving her body. More like this. Softer right here. Match her breath. Longer exhales calm performance nerves for both of you and help her body open rather than brace. Eighth, blend breast touch with what actually gets most women over the edge. Large representative surveys show many women climax most reliably with consistent clitoral or external stimulation, and some will orgasm from breast and nipple play alone, or when it is paired with clitoral focus. If she enjoys it, keep your mouth or hand on the breast while your other hand or a compact vibrator provides steady external stimulation. Maintain tempo. Change only one variable at a time so her brain can lock onto what feels good. Ninth, consider temperature and tools carefully, and only with enthusiastic yeses. A cool fingertip or an ice-kissed breath can heighten contrast. A warm palm or warmed massage oil can relax tight muscles. Keep temperature shifts mild and brief. If you are both curious about toys, adjustable suction cups or well-made padded nipple accessories can offer hands-free stimulation, but only choose quality devices. Start on the lowest setting and set a short timer. Skip these if there is any skin injury, pregnancy-related sensitivity, bleeding disorders, or neuropathy. Remove immediately if there is pain, blanching, or numbness. A few pro moves that change everything without trying harder. Warm your hands first. Keep your nails trimmed and smooth. Avoid strong fragrances on the chest. Support breast tissue during movement so nothing tugs. And practice aftercare on purpose. When you are done, do not just roll away. Pause, hold her, breathe with her, and let everything settle. Many women rate that decompression as the most satisfying part of the whole experience. Pain, burning, or persistent soreness are not part of it. If breast touch is routinely uncomfortable, pause and ask. Sometimes it is simply too much pressure or too fast. Other times hormones, cycle phase, recent exercise, skin irritation, or a medical condition are in play. Adjust. Try again another day and encourage her to loop in a clinician if discomfort keeps showing up. You do not have to be perfect, you have to be present. Ask, go slow, watch, listen, and let her body teach you. When you do, breast play stops being an afterthought and becomes a confident, connected part of your shared pleasure. Before we wrap, a quick word on the 2 natural supports I recommend. Organic watermelon extract rich in L-citrulline can gently nudge the nitric oxide pathway, the one that helps blood vessels relax, so flow cooperates when you need it. Many men notice a boost in firmness roughly 30 to 60 minutes before intimacy. The second is a well-built performance blend that usually combines Acarian tonkatali, fenugreek nettle root, and often a bit of citrine. Think of it as broader support for circulation, stress and libido, and prostate comfort, with some men also seeing healthier testosterone signaling after a few weeks of steady use. As always, these work best alongside the big levers: good sleep, regular training, and solid nutrition. Thank you for watching.